New study, first of its kind, shows that meditation is as effective as an SSRI anxiety medication for people with anxiety. Let's talk about it. So in this study published last week in JAMA Psychiatry, they took 276 people with an anxiety disorder and randomly assigned them to either go into a meditation program for 8 weeks or get first-line anti-anxiety therapy in the form of an SSRI called escitalopram. And this was designed as what's called a non-inferiority trial. In other words, they powered the study to determine if meditation was non-inferior to that SSRI medication, which we know from other trials works. And what they found at the end of that 8 weeks was that indeed both groups had a reduction in their anxiety scores. Both groups benefited, and that difference in anxiety scores was just about the same. And what they concluded is that statistically, meditation is non-inferior to that SSRI medication, escitalopram, which is really important because it tells us that instead of that medication, which comes with all sorts of side effects, costs, etc., people can derive the same benefit from an anxiety point of view with meditation. And people are always concerned about what meditation will entail and how hard is that to do. In this study, it was basically 45 minutes of trying your best to meditate each day and a one-day retreat to learn meditation techniques. And this meditation was based on the Buddhist Vipassana meditation, which basically calls for someone to use those 45 minutes to just focus on one part of their body and to focus on the now instead of thinking of the future and the past. And this kind of meditation has been studied before and shown to be effective for things like stress reduction, pain reduction, and depression, in fact. And we're not saying that necessarily it will always replace medications. Medications have a role too. In some people, it may replace medications. In others, it may be a complement to medications. But amazing study and a reminder of the power of the human mind.